Good evening, ladies and gentlemen, and thank you very much for joining us this evening. I would just like to first welcome our guest presenters, John Niemotko, Jasmine Kouch, and Cameron Collins. Firstly, I would like to introduce to you John Niemotko. John was a massage therapist prior to podiatry. His career in podiatry was initiated from when he developed an ingrown toenail and decided that he would treat his own feet back in 2000. 20 years later, he worked as the head of podiatry at the Calvary Health Care in Kogarah, here in Sydney. His path also included wound care at the St George Hospital in the high-risk foot clinic. And for the past 6 years, he has been a clinical educator at the University of Newcastle. John is currently working in a private practice on the Central Coast. So welcome, John, and thank you. Over to you.
Thank you, Anne, and hello to everyone. Let's bring up my presentation. Just want to make sure that everyone can hear me. Can someone just let me know that they can hear me and see my laser pointer, see my mouse? Yep, great. Thank you very much. Perfect. So I've been asked tonight to talk to you about the Lunula Laser, more so the science behind the technology and some treatment option comparisons, which I'm sure that you've all been using and you know a bit about already, and a little bit about the protocol for the use of the laser. But first of all, before we get into that, lasers are actually focused beams of light. So it depends, the wavelength itself determines the energy released. So with the Lunula, it's actually a cold laser or a low level laser. So it doesn't heat up the tissue and doesn't cause any nasty burns. As you know, compared to other types of lasers for the same purpose. Now it's a class 2 laser, so it's safe to use without the use of protective goggles, but still it's not a good idea to get your patients to look into it because it's similar to a laser pointer. So it won't damage the eyes, but it's not comfortable. There are 2 beams and they intersect and they rotate around, and this allows the nails to be covered. So all the nails can be treated at the same time, which is, I think, something very different to other types of lasers for onychomycosis. But I'll discuss the actual lasers and the beams later on. Now, just to let you know, the Lunula laser itself lies within this visible light spectrum, so within 400 to 700 nanometers. So it has a little bit of UV and a little bit of infrared, but by and large, it lies within that visible light spectrum, which means that it doesn't actually damage your normal tissue cells. It just focuses on the microbial side, which is very good for our patients. And how does it work? It's actually a process called photobiomodulation. Now, what this is the use of 2 laser beams with 2 different wavelengths that do different things. So the first one I'll talk about is the red beam, which is 635 nanometers. So that's the actual wavelength itself. And this improves healing. So it targets cytochrome C, which is in the mitochondria cell. And this produces ATP that then converts to nitric oxide. It's a cascade of events which occurs, and the result is that there's vasodilation. This improves blood flow and results in a boosting of the patient's immune system. Now, another side point is that what this does is it makes the nail grow out faster. So as you're treating the nail is growing out quicker and you're killing the fungus, so it's able to be taken off faster as it grows out. And then secondly, you've got the violet beam, which is 405 nanometers. Now this is the one that targets the fungal cells. it produces reactive oxygen species, which is a type of oxidant, and then it can, which then converts to hydrogen peroxide. Now, what the hydrogen peroxide does is it weakens the fungal cell wall, and without the protection of the wall, the fungal cell dies. So this laser is actually fungicidal. It's not fungostatic. So it actually kills the fungus within the nail. It penetrates deep through the actual nail plate and kills the fungus as the nail grows out. And this is just a nice little pictorial which kind of summarizes what I've just talked about. So the two beams of light and the reactions that they cause, resulting in, one, increased blood flow and improved immunity to the site, and the nail grows out faster with the fungus dead pretty much within the nail plate, and the fungal cell itself is the wall is disrupted, so that's how it actually kills the fungus. This is another slide showing your Doppler ultrasound. So this is a normal nail. So this is the nail plate here, and this is the normal blood flow to the actual matrix of the nail. And this is after a treatment with the Lunula Laser. So here we've got increased blood flow, and this encourages that nail plate to grow out quicker and also boost the immune system. So what conditions can the laser be used for? There's a variety. But the main focus tonight is regarding the onychomycosis, and that's certainly what the research is kind of in favor of. But there is some promising research out there that covers these other conditions. Now, the main way that works is either antimicrobial in its action or increasing blood flow and improving the immunity response for some of these other conditions. Now, we all know that onychomycosis is a very difficult condition to treat. And quite often we need to make a differential diagnosis. So it is encouraged to take a nail scraping to confirm the presence of the onychomycosis, especially if a patient is going to come in and use something like the laser, which can be, from the patient's perspective, quite expensive over a period of time. But then again, on the other hand, we all know that taking a nail scraping can be a little bit hit and miss, and it's not always accurate. So just keep that in the back of your mind as well. So treatment options that you're probably using all the time is either do nothing and see if the patient's own immunity will kind of kick in, or there's home remedies that sometimes can be dangerous. There's a topical lacquers such as Loseril and Dactarin. Not always that effective by themselves, unless it's a very, I suppose, superficial fungus on the nail, and it takes a long time to actually treat as the nail grows out. So here, compliance may be an issue. There's the tablets. So with these come a whole range of side effects, especially regarding the liver, and they have a 50-50 chance of actually working as well, especially if there's poor blood supply to the area, because don't forget the medication has to get down there somehow. So the patient needs to have good blood supply for that medication to reach the nail. There's surgery. So for patients that really just are fed up with it and just want to get rid of it, they can have a TNA or PNA, depending on where the fungus is. And there's always risk with that in terms of healing time, pain after surgery, bleeding, infection. And then there's the hot laser or the thermal laser therapy as well. So this can actually result in burning of the patient. It takes a while, especially if there's multiple nails involved. And if you miss a spot, then that nail fungus just grows back. So why the laser therapy? So effectively, Lunula, it actually penetrates through the nail plate to get to actually treat and kill the fungus. It has no known side effects. There's no pain. It's quick and it's very, very easy. So unlike some of these other treatments, it's a really, really good alternative for your patients. Now, if we were to talk about the Lunula, it's a cold laser, so it's not a hot laser, so it does not burn the patient. That's really important to stress to your patients. You can actually treat all 10 toenails at the same time, so instantaneously, depending on the size of the foot. The patient doesn't actually feel anything. So I have had patients reporting a slight buzzing feeling, or it feels a bit warm, but I think that's more psychosomatic. I've had this treatment for myself as well, and I certainly couldn't feel a thing. And this is something that you can sit the patient down, get your support staff to actually finish off, and you can be straight on and treating the next patient. So it's a really cost-effective and time-effective treatment. If you were to compare it to the thermal or the hot laser, this can cause burns. It can be time-consuming because you have to actually sit there and go kind of up and down and left and right and cover the entire nail plate. And if you've got multiple nails involved, you're spending a lot of time with that patient, and you have to wear the protective goggles. You have to kind of have a sign that there's radiation in the room, all that kind of stuff. Whereas with the Lunula, you don't have to do that at all. And once, like I said before, if you miss a spot, then you can leave a spore behind, and then the nail fungus just regrows. So this slide just summarizes what we kind of talked about. And the main take-home message here is that studies have shown that the Lunula laser is actually up to 90% effective. So that's quite high in terms of trying to treat the ever-present and very difficult to treat onychomycotic nail. So let's now have a quick chat about the actual treatment protocol. So the research has shown that you don't actually need to drill or thin down the nail because the laser will penetrate through, but it's probably a good practice to do it anyway. So I typically would cut the nail, drill it down, or file it down to make it thinner, because it shows the patient they're actually doing something active before you pop them in the laser. And that's probably the first time that they get treated, and then maybe a few months down the track as well. Because with this, it's 12 minutes of treatment time, and you do it once a week for 4 weeks for the first sessions. Now that's really important to follow that protocol. So once a week for 4 weeks, and then after that you can choose to either do it every 6 to 8 weeks or 10 to 12 weeks until the nail grows out. So it could be anywhere between 6 and 12 months, depending on how badly affected the nail is. And the way that's measured is you take photographs and you measure the amount of healthy nail in millimeters. So as the nail grows out, you shouldn't get any more regrowth of the fungus proximally along the nail plate. And essentially what you would do, if you can see my cursor there, is place the foot inside the device, and where those two light beams intersect is where you kind of put the middle of the nails. So if it's just one nail, you just kind of intersect it there. If it's multiple ones involved, you kind of put the middle of the foot inside, and the actual beams rotate around, and they have that impact on every single nail that's in there. And it works really, really well because it covers the entire area. So you can treat those 5 toenails instantaneously, or if both feet will fit, you can treat all 10 nails at the same time. Just as a word of caution, there are some contraindications, and that is any history of cancer in the foot or any active cancer within the patient's body. Now, this is mainly because you don't want to agitate any cells and get a cancer to regrow or to get re-stimulated. The other one is pregnancy. Now, it's not because there's been any ill effects with pregnancy or any adverse effects that are known, but it's more so around the fact that when, if anything goes wrong within a pregnancy, people tend to look back and think, okay, what did I do differently? And they think, oh, I went to the podiatrist and had that laser treatment. Oh, maybe that's got something to do with it because they use lasers. So it's more so that perception, and you don't want to be in that situation where you're in litigation and it's just it's a really bad spot to kind of be in. Now, the other thing that I always talk with my patients about is foot hygiene. So making sure that they're treating their socks, their hosiery, their bed linen with like a Keniston wash, and putting them out in the sun, because the UV rays actually kill the fungus, and that works really well. There's also the STERI shoe. Now, the STERI shoe uses UV light to actually kill fungus within the shoe. So you place the device inside the shoe, turn it on, and it just zaps the actual fungus inside the shoe. Now, this is really, really good, because patients come in and they see you at least once a week for 4 weeks. So you tell your patient, why don't you bring another pair of shoes in each time you come in, and we'll go and zap them all. So they're getting their 12-minute treatment on their nail, and you can do a 15-minute zapping of the shoes to kill any kind of fungus within their footwear. And it works really well from that perspective, just to kind of maintain and prevent reinfection. Now, my own experience has been that I've actually set up the laser at the University of Newcastle Clinic at Wyong Hospital. I've had some great results with the patients there. I've used it in private practice as well. And I've actually used it on my own nail. So my right hallux developed a fungal nail infection, and I zapped it in the laser for 4 weeks, and that's all it took. And then it grew out. I was able to cut it back, and it hasn't come back since. So that was probably about 18 months ago, and it's worked really well for me. So, and it works great for my patients as well. So I thank you for your time. And now I'm going to pass over to my colleague, Jasmine, who has some case studies. Thank you, everyone.
Thank you, John. Firstly, I'd like to introduce Jasmine. Jasmine is the owner and podiatrist of Two Right Feet Podiatry in Victoria. Looking back, one of Jasmine's most memorable experiences during her time studying podiatry at La Trobe University was the opportunity to go on placement overseas to work alongside an experienced team of acute and biomechanical sports podiatrists in the largest hospitals in Singapore. Since then, she migrated, she even once considered migrating there. Now she's a local to Kilsyth. Jasmine can be found practicing Pilates in Croydon, going to the local badminton centre to have a hit and walking her Groodle puppy Pancakes. While she loves treating most things, her favourite patients are primary school children coming in with growing pain, or parents with ingrowing toenails or heel pain. So without further ado, over to you, Jasmine. Thank you.
Thank you so much, Anne, and thank you, John, for the amazing presentation. Just quickly, can everyone see and hear me?
Yes, all good.
Yeah, all good. All right, amazing. Thank you. So I am here today to talk to you guys a little bit about my case study experience with the Lunula Laser so far. I have, just to talk about the best practice, what I've been doing, and also just to talk through both the really successful cases that I've had and the ones that I've struggled a little bit more with, and just to, give you guys an idea and a rundown of what it's been like for me and having it in the clinic. So just a quick overview. I am the director and podiatrist here at Two Right Feet Podiatry and Myotherapy. I purchased the Lunula Laser early last year in February, so a year and 3 months ago, and I have been using it ever since and found that it has had astounding results. I've really loved using it because it has given me a gateway to have an option for my patients, rather than just going like, oh, try this, try that, and then we'll just kind of see. And it was all really fluffy. So now that I've got something that I can really go well and truly say, hey, I definitely know that this treatment works, yeah, it's been really positive so far. So I wanted to run you through everything. So first of all, why the Lunula Laser? Because it is, as you guys would know, quite a big investment. My big thing is that I was really frustrated with the results of topical treatments. Typically before, I was recommending for my patients to use tea tree oil or white vinegar, like those home remedy things. And even that, or even those things that you buy from the chemist, were really hit and miss. And you would see definitely that some patients would see some improvement and some really weren't. And you can kind of go week by week and just feel like, oh, you know, it's kind of getting better, but you don't really know. And it's all just kind of all this persistence that you feel like you're trying to push with your patients, and they tend to drop off the radar because of their lack of trust that it's going anywhere, because not necessarily because of you, but also just because of the whole process. The other thing is that I was seeking an alternative to offering oral medications. Oral medications have been amazing, definitely for some of my patients, but for the patients that either couldn't handle or preferred not to take something orally, it was amazing to have something like the laser to go, well, this doesn't have side effects. This has been amazing if you're worried of those side effects that oral medications can have. I know that there are other laser treatment, or not laser treatments, but other therapies out there like the PAC therapy previously. And when I was in university, I observed a podiatrist in her practice, and she even said to me, even though she was the one that owned it, said that it was really mixed results. So she was saying it was very up and down. So I hadn't used the PAC therapy myself, but that's what I had heard from her experience. So I kind of didn't quite want to go down that road. Yeah, so I'll go through with you first of all, my best practice assessment routine and goals. In what when I was talked through the whole process of how it would work, I actually have kind of slightly changed it as I've seen it go along with my case studies, just because I found that sometimes 8 treatments isn't enough. So I'll explain to you what I've done now, just lengthening forward as well. So this is my treatment timeline. So on your first appointment, you would assess the patient's toenails, you know, do they not have fungus? And then I would always take a photo and put them in my little album. They get an album each, which they get to look at over time, and we can reminisce about their toenails. We would also burr the nails back. So like John had said previously, I would, on the first appointment, cut their toenails back, do the general care, and really grind down their nails as tolerable for the patient as possible. And then I would bring them into the room that has the STERI shoe, and I would always recommend for them to bring a different pair of shoes every single time, or whichever shoes that they would use most often. And either for them to rotate them between appointments, or if they had 1 or 2, they would just literally bring in 1 or 2 every single time, and then put them into the Lunula for that 12 minutes per foot. And the most important thing, like what John said, education is really the most important, because at the end of the day, the Lunula does amazing work. It fixes the problem, but it cannot prevent it. So if they pick up fungus, the onychomycosis down the track, like, we can't prevent it from coming back, essentially. So I've always said to them, what you can only do is try and prevent it from coming back by making sure what you do at home keeps it clean, gives you the best chance possible to really kick this to the curb. So what I normally recommend, and I actually give this to my patients as part of the package, is I give them a bottle of the Caniston antifungal washing liquid, which you can buy from Woolies for like $8. And then I also give them a bottle of the Dactarin spray to spray into their shoes. Otherwise, I always say a little nice home remedy is white vinegar and tea tree oil. So something like that, something to help make sure that they have some onus over their own care at home. So I say, make sure you clean your bathroom, clean your sheets, wash your clothes, and even particularly after they've done the big haul in the first appointment of cleaning, I say separate your socks into a separate tub when you've used them. So then whatever is obviously fungal goes into that bucket, and that goes into a separate wash on its own over time. And then they can do another full load again once at the end of their treatment. They can do the full big deep clean of their house again. So that is the first appointment. That's what I normally explain to them. I even give them a card to explain everything as well. And then on their second and third appointment, we come in, we just come do the STERI shoe, we just put them into the machine. And then on the fourth appointment, I bring them back into my treatment room and we take another photo and we do the general care again. And we actually, in this appointment, I really love showing them what 4 weeks looks like, because 4 weeks, even though it's not super long of a time, you may notice some change. So sometimes some of the change can be as simple as the yellowish color on the nail isn't as yellow anymore. It can turn a little bit more whiter, or you see that the nail has slightly grown out a little bit more, and it gives them a little bit more hope and a little bit more like, oh my gosh, like I really feel now invested into this process. Because I feel like the hardest thing with anything like this is that people get demotivated and you lose them through this timeline. So yeah, I normally do check in with them and ask them how they're feeling and how they think it's all going as well. So that's my big thing and big recommendation from the fourth appointment. So between the first and the fourth appointment, it's on a weekly basis. So you would see them week by week for that whole month. And then after that, depending on how their nails look or how infected, well, I guess how much of the nail is infected. So if it's 50 or more %, you might see them a little bit sooner, but usually I see them at a 4-week mark after their fourth appointment. So for their fifth appointment, 4 weeks after their fourth. And then we would do this whole process again. So we would take a photo, do the general care, put their shoes into a STERI shoe, and then go through the Lunula again. Usually if by the 8th appointment, there's not a significant change, I generally kind of go, oh, is there something going wrong here? Have we not educated the patients enough? Have that, like, you kind of go through everything again. Have you been cleaning? Have you been, what's been happening? Have you been giving the nails trauma per se, like, or something along those lines? Is there something that's stunting that healing essentially? And then that way we can kind of get an idea of what to do next if need be. Sometimes when I say, is there something else that we can do? Sometimes some patients are very happy to add a topical treatment alongside the laser, which is not necessary, but in some ways I almost feel like they like having something to do and feel like they've got something that they can feel, how do you say it? Like they can really take ownership of their health in that sense as well. So I'll go through a couple of my case studies now. So these ones, we'll go through the really, really awesome ones that I've had first. So this is Yvonne. Yvonne, I literally only saw a couple of days ago, and I asked her if I could put all her photos in because I was so excited. She's 69 years old. She tried topical lacquers previously, and it's been going on for a few years, and she was obviously quite unsure about going down the oral medication route because of her age. So this is what her nails look like on her first appointment. So you can see that it was quite thick, particularly on this left first nail. And then a lot of the other little nails were kind of a little bit more on the ends. And this is what it looked like last week. So I discharged her after 6 months. So we started in October and we just finished last week. So that was 9 appointments in total. And you can see that it hasn't quite fully, the nail hasn't fully grown out yet, but it was completely in the right direction. So yeah, the next patient here I have is Catherine. She's 30 years old and a librarian, and she hasn't had previous treatment before, and she wasn't really too bothered by it because mainly it was only on her right big toenail, and she wasn't too worried about the look of it until her left big toenail pretty much fell off, and that's when she went, okay, well, something's really wrong here now, and decided to start treating it. And so you can see that it fell off and it wasn't growing back. It kept actually growing up to a certain stage and then just falling off again. So this was when I saw her last. You can see how much it's now grown out, and all that all the mycotic nail has grown out now. So that took about 9 months altogether. Okay. And this is Amy. Amy is 51 years old, and she didn't have any previous treatment either, but she had gone to the GP and had the pathology testing and everything, and it all came back positive for the onychomycosis. And the GP then recommended for her to do oral antifungals, but she was completely concerned about side effects. So she didn't want to go down that route. So you can see it was all mainly in through her kind of the sulci corners, really through the corners of her nail. But after a good 8 months, which was 6 sessions of laser, it's completely grown out. So it looked awesome. Yeah. All right. So I now, because obviously with the good, we'll talk about some of the harder cases that I've had. And these were the people that I've found we've seen for quite a while now, and it's taken a little bit longer than I'd like to see a change. And you'll see what I mean when I show you. So I've got the first one, Christine. She's 61 years old, and you can see with all of her nails, she had a lot of lifting through most of them. And it was pretty much just both of her second toes that were unaffected. And which the frustrating thing is that even after 14 months, it has improved to some extent, but a lot of it still kind of remained the same. And on top of that, even the right second nail has actually become mycotic as well. So that was a bit of a difficult kind of pill to swallow, and we've been trying to figure out what to do next. We've been actually decreasing our appointment time. So now I think we're seeing her every 2 or 3 weeks. So we're really grinding them back, really cutting the nails back now and being a bit more aggressive about it. And she's very, very good and diligent with her hygiene at home. But we think as well, because she does work at reception in a hospital, she's always in shoes that has to be closed-toed. So we were thinking maybe it was kind of along those lines where her feet never really got much air. That's why we're struggling a little bit more, but we're not 100% sure. Next we have David. He's 60 years old and he has Parkinson's, and originally attended to me for a plantar plate tear in his left second toe. So you can see that toe's really bent, and both of his second toes are actually much longer than his big toes. And this was the trouble with David, was that because of both his Parkinson's and his Morton's toe, the longer second toe, he was actually getting a lot of trauma, particularly through that right second toe. And that's why this toenail, he calls it his mother fungal toenail. And so, yeah, we've really, really struggled with trying to get that toenail down. You'll see what I mean in regards to his treatment. So this has been 8 months, 11 appointments. So at first we actually started with 2 weeks at a time, and then now we've gotten to 4 weeks. But you can see that there's been a really marked improvement in his left first toenail, and even through some of the other little toenails particularly. But that right second toenail and the right first toenail, I think because both of them always constantly get trauma, have been very, very difficult to try and push further. So yeah. All right. And lastly, we have Bonnie, who she's 28 years old. And I wanted to partly give you a couple case studies with younger people as well, because I think that was really important to know, because I do find in general, our younger patients have done really, really well and always seem to get fixed a lot faster. But in this case, I'll show you what I mean. It wasn't quite the case. So you can see that she actually originally went and saw another clinic with a Lunula machine who actually unfortunately closed down during the pandemic. So she had seen them for 6 sessions prior to seeing us. And she said that most of her nails had completely cleared because of it and was pretty much coming to see me for that 3rd toenail. So what happened was I saw her for her 1st and then to her 5th session. So that was within the space of 2 months. And then life happened and she couldn't see me for about 4 months between her 5th and her 6th session. And then her nail just blew up, like her big toenail just got completely infected. And she was so upset. Yeah, so unfortunately, we pretty much had to start from ground zero again. And now we just finished our 9th session trying to get that big toenail back and grind it back as far as it can. But unfortunately, this is where we're at now. So in conclusion, I wanted to just mention older patients tend to take longer just because of blood flow in their general immune system. If they've had their fungal infection for longer, the longer the treatment timeline will be. So I think it's good just to mention that for those patients who have had their onychomycosis for longer, so then at least you can tell them prior that this may be a little bit of a journey. It'll be obviously quicker than if they did their lacquers or something like that with a very low rate of success, but this is still going to be a long process. So we're going to be best friends. The use of nail polish really sets the treatment timeline back. I had, wasn't one of those cases that I showed you, but I had a girl that got married recently and she only put a very, very light layer of nail polish just for her wedding day. And it went backwards about 3 sessions. So yeah, unfortunately, that is one thing. The consistency is also very important, as with like kind of what happened with Bonnie. Trying to get the patients back within that treatment timeline is really important. So then we can, make sure that they're not spending money for no reason, and also making sure that they're doing all this hard work for it to all kind of be negated later in the future. Sunlight is actually amazing. Like, just natural sun is incredible. I find that all the people that we see that are in occupations that are in shoes for longer, so for example, your tradies, sweatiness and all of that, they do tend to be harder to treat. So even I've had younger patients that are in their 20s that are always in work boots. It still takes almost as long as sometimes some of my older patients. And lastly, education is absolutely vital. You want to give them the best chance of getting rid of their fungus. Unfortunately, this is something that they've had to live with for a long time. And you want to be able to not only get rid of it, but make sure it stays gotten rid of. So thank you so much. If you have any questions, let me know.
Okay. Thank you very much, Jasmine, and please do sort of stay with us so that you can answer some questions. I think we have had a couple coming in already. So lastly, let me introduce Cameron. Cameron Collins is the co-founder and lead clinician of Fungal Nail Solutions. He grew up in Wellington until he moved to Auckland to attend the Auckland University of Technology. And as a person who suffered from several foot-related issues, he found a passion for the emerging field of podiatry, which has subsequently led him to develop a special interest in foot and ankle pathologies. After completing his BHSC in podiatry, he moved to the Waikato to begin his career in podiatry. I hope I've pronounced that correctly. From the beginning of his career, podiatrists in the Waikato mentored him. Cameron has a special interest in the diagnosis and innovative treatment of fungal nail infections, with an admirable commitment to ensuring best patient practice. Cameron continues to reside in Hamilton whilst undertaking further studies in physiotherapy. Don't leave us, you've got to be a podiatrist, Cameron, we need you.
Yeah, absolutely.
So over to you.
Absolutely. Perfect. I'll just share my screen. It always It always sucks going last, but especially when everyone manages to navigate the technology okay. But hopefully I can do the same. Here's hoping. I'll just make that a bit smaller and pop that up. I'm guessing I'm good to go. If I'm not, someone stop me. So thanks, and obviously thanks to John and Jasmine for your insightful discussions around the laser itself. I've certainly learned a lot myself being a laser user. So as everyone is aware now, my name is Cameron Collins. I'm the director and podiatrist at Fungal Nail Solutions in Hamilton, New Zealand. And Fungal Nail Solutions is a clinic specifically set up to assess and treat patients with fungal nails. I obviously have the job this evening of talking about the return on investment of the Lunula cold laser in our clinic, and hopefully share some business insights with everyone. So as everyone is obviously aware from the get-go, one of the biggest questions that a clinic or clinician ponders when considering the Lunula laser is the upfront costs and whether the return on investment is worth the capital invested, or if you already have a Lunula laser, how can you make the most out of your investment? So before I get into the presentation itself, I do want to make a bit of a disclaimer about the figures that I'll be sharing with you tonight. These are all based around a clinic which is located in Hamilton. So to give everyone a bit of a gauge, if you haven't been there, probably most people haven't, the population is about 500,000. We've been open for about a year, so obviously that year has come with significant challenges around COVID, multiple lockdowns here in New Zealand, and as well as most patients paying privately, which I believe might be a slightly different funding model to what you guys have over in Australia, which I believe is what most of the audience is this evening. So I guess I'll start off by giving everyone a bit of an idea as to our clinic pricing for the Lunula laser. So we offer an initial consultation, which is 30 minutes. Obviously, we use this appointment to assess, diagnose, and discuss the treatment options available to the patients. We then have two different pricing schemes that we use. So we have a basic appointment and we also have a comprehensive appointment. We do provide debridement at every appointment as kind of a value-added service. And as John's kind of said, feeling as though the patient's getting something as well as the laser. And unless it's a really acute infection, we don't tend to see people weekly, but that is also on a case-by-case basis. So therefore, with the laser, I don't know if you Aussies have slightly smaller feet, but it's really hard to get a Kiwi person's wide 4 foot, 2 feet in the laser. So obviously the time taken per appointment does differ from 1 toe to 10 toes, which is reflected in our pricing. Another thing worth mentioning here is that we believe that people buy from people, and seeing our patients during each appointment does build what I would believe to be better rapport and makes developing patient-centered goals and modifying these goals over the course of treatment much easier when a patient has a relationship or a trust built with the clinician. And that I found that this isn't always possible if the debridement is carried out by the podiatrist, but then the laser carried out by the receptionist. But that obviously does impact our overall profit margins as well. Then we obviously have the review consultation, which is obviously an opportunity to monitor and discuss the treatment progress over time. It's obviously recommended from the get-go that you kind of package your treatments so that you kind of avoid no-shows, which is always the bane of everyone's existence, and also ensure commitment from the patient throughout the whole treatment process. We decided at Fungal Nail Solutions to go against this model, however, allowing patients to kind of pay per consult. We've found that cost is always going to be one of the biggest barriers that stop patients from undergoing the Lunula treatment. So what we've found is telling a patient that they have to pay $780 up front can appear reasonably unachievable for many patients, especially in a time in New Zealand anyway, where we've got a cost of living is increasing. And obviously that means that our disposable income is reducing. Whereas if we tell a patient it's going to be $130 per session, we're going to see you every fortnight, that brings it down to sort of $65 a week. It does appear to be far more achievable in the patient's mind and allows for a greater level of commitment from the get-go from our patients. We've also found that this does not tend to result in significant no-show rates, as most patients who embark on treatment are committed to the treatment. And once they find the laser, they've usually tried a whole lot of other treatments anyway, so they're really ready to get on top of the treatment. And we're kind of yet to have anyone stop treatment midway in the year that we've been practicing. Finally, although these are our prices, I don't like cost to be a barrier for a patient's treatment. And ultimately, we want to maximize the laser's operational time. If the laser's sitting in a clinic being dormant, not being used, it's not working for the clinic at all. Now, this isn't something that we want to be doing all of the time with our patients, as it does affect our margins. However, if we get somebody in our clinic who can commit for $100 per session, for example, it's better than them not committing at all. Yes, we might lose $180 once we take into consideration the discounts there, but the way we look at it is that we actually gain $600 in revenue over a course of a 6-session treatment, as opposed to them walking out the door after the initial consultation and the clinic earning $0 in revenue. So just something that we've thought about over time and something to consider. So the return on investment itself, so obviously I've broken this table down into sort of a higher earning summer versus winter. So if we have a quick look into what a return on investment might look like, again, based on our clinic figures over the past year, COVID, obviously based in Hamilton, our marketing is reaching 500,000 people. So just things to consider yourselves when looking at this. As you can see, we've broken summer down into November to March, and we've broken winter down from June to September. So the Lunula treatment package remains the same between seasons, obviously, with patients kind of spending an average of $1,095 for a treatment package, which is obviously consisting of that initial consultation, 6 laser sessions, and then 3 review appointments. Obviously, some patients will spend significantly more than that, others will spend significantly less, but that's kind of on average. Products and upselling is something that I'm going to talk about soon, but for now, patients will generally purchase 2 products, averaging $100 over the course of their treatment. In regards to the monthly advertising, myself, and I'm sure many of you are too, love working clinically, but maybe don't put as much time aside as we should, focusing on the marketing side of our practices. On top of our general networking with our referrers, we spend about $400 each month on Google advertising. It is important to highlight that we spend the same amount on advertising during the highs and lows, and you can make the connections that you want during this next part here. But it's an interesting point that we spend the same amount and we look at our new patients per month. So we generated on average 17 new patients per month during summer, which results in about $100,000 worth of practice revenue, of course, for patients' treatment from start to finish. Whereas during our winter months, we're generating about 9 new patients per month, bringing in about $41,000 worth of practice revenue, again, over the course of their treatment. So the first thing to point out here is these numbers do not include clinical overheads. Obviously, these significantly vary from clinic to clinic, so you must consider this when looking at these figures. And secondly, it's important to point out that we've found this intervention to be incredibly seasonal, so revenue generated does fluctuate throughout the year. As everyone's aware, fungal nail infections themselves are generally not painful nor life-threatening, and therefore it doesn't appear to bother people until they're in open-toed shoes again, particularly during summer, but this obviously might differ for people living in warmer climates. So the general rule of thumb here is make hay when the sun shines. During summer, you want to invest as much as you can into it because that's where you're going to get a lot more of your punters coming through, and then winter you might want to be focusing on something else. But overall, the return on investment from our clinic has been incredibly good. So our business model, and obviously in the concept of upselling, which is what I've been talking to you about today or this evening. So upselling is fundamental to our business, not necessarily as a revenue gathering exercise, but to get the best results for our patients. So as previously mentioned, core basic appointment standard to any laser journey at our clinic obviously involve the initial consultation, 4 to 6 laser sessions, and 2 to 3 review appointments. However, obviously, we intend to provide a full wraparound service for all of our patients, and this is basically just to get the best results for our patients, which includes the purchase of clinical products. This wraparound service not only improves clinical outcomes, but also obviously increases your business profits. So I've kind of broken down the upselling into 4 segments. So diagnosis, additional treatments, treatment products, and then aftercare as well. So diagnosis, obviously if a patient has not had a confirmed diagnosis, we always recommend patients getting the diagnosis right before embarking on a treatment. That may actually be suitable, but it may not be suitable for their nail pathology. Obviously, some patients will come to your clinic already with a diagnosis from a lab or other podiatrist, but if not, we do offer the Factory test kit, which we obviously charge at additional costs. Additional treatments. So obviously sometimes a combination of treatment inclusive of the Lunula laser in order to get the best results for the patient. This is dependent on your own clinical processes, but in our clinic can include, and quite popular, is a chemical debridement or a total nail avulsion in combination, particularly with those more total dystrophic nails. And then the other one that's incredibly popular is our Keriflex or nail reconstructions using the resin. Obviously fundamental to a successful treatment, in my opinion, is aggressive debridement to remove as much of the active infection as possible. And obviously this can be a turn-off for many patients, but giving them a short-term alternative does make them more comfortable committing to a full debridement. Treatment products, obviously it's been talked about already throughout this webinar, but having good hygiene and prevention strategies in place is imperative to any successful treatment plan. This is obviously based around removing that warm, dark, damp environment that your feet are constantly in, or in many patients' cases anyway. And this can obviously include products like topical solutions, foot deodorants, athlete foot creams if we're dealing with a skin infection as well. Obviously the UV lights that have been talked about, laundry rinse, and the other big seller for us is bamboo socks. Obviously have fantastic moisture wicking properties. So obviously people that have incredibly sweaty feet, particularly at work, and leather shoes, work boots, bamboo socks are always a bit of a goer for us. And then aftercare, so I guess our clinic has a goal of discharging patients at the end of their treatment program. We're not a full podiatry practice, so we don't like to keep patients on as general patients. You may wish to keep patients on your books as general appointments for nail care, but we like to equip our patients with the ability to self-manage, which obviously can include the sale of good podiatry-based nail clipper sets with files and emery boards, and also mechanical nail drills for those that are interested. So as you can sort of see here, there are a lot of upselling, or is a lot of upselling that can be done. High product margins, though, can be difficult given the bargaining power that large pharmaceutical companies like the Chemist Warehouse have. Sometimes it's cheaper for us to actually go to Chemist Warehouse, buy it, and then put a slightly bigger margin on it in our clinic. However, clinical products sold in-house are convenient for many patients and allows us to equip patients with all of the tools that they need to complete a successful treatment protocol. So hopefully that kind of gives everyone a bit of an overview as to the possible return on investment the Lunula laser can provide for your clinic. I think we can always make figures sound incredibly good on paper though, but in my opinion, ultimately it's the way in which clinicians deliver treatment interventions to patients that really helps get the best return on your Lunula laser. And I guess finally, my details are on the slides here. If anyone wants to have a further discussion with me about the laser or any other aspect of my clinical practice, I'm certainly more than happy for you to get in touch with me. So that's pretty much me. I'll flick you back to Anne, I think.
Thank you, Cameron.